COVID-19 is the serious disease caused by the highly contagious coronavirus. It spreads so quickly because it takes several days to show symptoms, and most people won't even know they have it yet. This virus has the potential to make many of us sick with fever, coughing, or even resulting in death if we don't take drastic yet simple action. While researchers continue to develop a vaccine, there are things everyone can do to help slow its spread. Stay home, unless you have to go to the grocery store, pharmacy, or outside to exercise. Wash your hands frequently for at least 20 seconds, and practice social distancing. But what is social distancing? Well, it's just like it sounds. Distance yourself from others at all possible times. A virus only spreads if it has someone new to infect. So if we all put at least 6 feet of distance between each other, the virus will have nowhere new to go and will eventually run out of steam. Following these rules is critical to protecting people with underlying health conditions, as well as the senior population. And keep in mind, this even includes our own grandparents. These at-risk groups have been hit hardest by the virus, and they need our help to stay safe. Look, we know this is a challenge, but if we want to stop this deadly virus in its tracks, we must practice social distancing. There are all kinds of ways to meet with your friends, family, and community virtually. Try video calling with your family, playing an online video game with friends, or even having a phone call with the people you know. The bottom line is this: COVID-19 isn't something we want to tangle with. If we all keep our hands clean and practice social distancing, we'll save each other's lives by giving the virus nowhere to go. And keep in mind, we may have to keep doing this for several more weeks to come. Stay home to stay safe, working together to live together, at a distance. It's up to all of us to stop the spread.
Hello and welcome to The Talk with Tariro. Last week on the program, we were at Mashambanzo, where we were looking at the issue of HIV care treatment and support. And like I promised, we're also going to be looking at that particular issue. But now looking at this COVID era, a lot of people going to health centers. It's quite scary because of the fear of actually getting an infection. So for us as The Talk, we actually felt, let's just go to Mashambanzo and find out, particularly from people who are there as patients. We're going to find out from visitors who are actually coming to see people who are here admitted at Mashambanzo, as well as to hear from the institution, as a health institution, what are the precautions that they are putting in place to ensure that we are protected from COVID-19. I know as we're getting in at the gate, we're sanitized, our car was sanitized, the social distancing, we are maintaining it, putting on gloves. Yeah, we had to take off our masks just for the purposes of this recording, but everyone is actually masked at this center. And to help us to discuss that particular issue on the program, I'm joined by Sharon Gay. I asked her what her surname means, and she says Chirungwich. Sharon, welcome to The Talk.
Welcome.
Yes. I want to find out from you, when did you come to Mashambanzo?
Yesterday.
Yesterday. Are you admitted here?
Yes.
What is the problem?
Nandiriku Suburban Hospital private. Daita problem chaya. Saka ndandishira kwa ikoko. Saka ndandanzi ndiwedzere ropa and ndiwedzere ma fluids. So ndakawedzerwa. So pandakabva ikoko ndakabva uya kunoko just because ndombo refreshawo nchimbo monitorwawo bose. I'm having my challenges ekuti makumbo angu ari kuzvimba and maoko. Saka ndakangobva kuchipatara and then vakabva ndunza kuno kuti ndimbo refreshawo nekumbowonawo vamwe and kumboita kuti ndimbodzokera pasystem for some time. Then
first time yako here kuya kuno kuti kana vantu wakambouya?
Yeah, it's my first time.
Uri kuti hanzi ndodomboya kuno kumborefresh. Kwakasiyana here nemamwe mahospitals kana wakatarisa panapa as a center?
Yeah, pakasiyana. Nekuti kuprivate unenge uri muroom mako wega. Unenge unogona chiremba. Nesi manje panapa unogona kutaura nevamwe vanhu and unosangana different types of people, different types of background. Saka unenge uchitaura nevamwe uchinzwawo situation yemumwe.
Muri musame condition iyoyo.
Tinogona kunge tiri different conditions asi tiri pasame nzvimbo ndikutodzidzawo something from someone.
Nyaya ndiri kunyanyoda kunzwa from you Sharon inyaya ye precautions ari kuitwa health institutions. Wataura kuti iwe wanga uri kune imwe hospital ukabva wauya panapa. Ndoda kunyatsonzwa kuti iwewe uchiti inini ndiri munhu sekuti ndiri murwere handiti ndauya pacenter. Zvii zvavakaita? Nekuti kavabvunza vanotiudza kuti tinodai asi ndoda kunyatsonzwa from iwewe from your own experience. Zvii zvawakaita kuti ungati ndiri safe from COVID from zvawadzidza zvinotaurwa nehurumende mumaradio mumatelevision nezvese zvawambodzidza pamusoro COVID?
Alright. Panyaya dzeCOVID ndakadzidziswa nenyaya yekuti vanhu paart vakangofanana nemwana mucheche. Like mwana mucheche anenge achida care yakanyanya kana abva musununguro, abva mubarwa. Anenge achida kugara achidzirwa ari pano pari ball. As in vanhu vari paart munhu anenge utori infection kudhara. Saka it's easy kutambira zvirwere zvakasiyana siyana. So vanhu vari positive vanofanira kutogara vari protective vachigara mudzimba. It's not kuti tofanira tobuda panze stuff but tofanira kunge tichitodzivirira bosa gara vanenge utori positive kuti utori nechirwere chinogona kugamuchira any sickness.
Saka zvii zvakaitwa iwewe uchinzi usvike pano kuti ugoti ndiri safe kuti ndaudzwa ndofanirwa kuzviprotecta but ndiri kuenda ndirinosangana nevanhu vakawanda. Zvii zvamuri kuita panapa kuti munge musingatomboti paita one ane COVID musatapurirane? Zvii zviri kuitwa?
Vari kuti pamatablets ekupreventa COVID and togara takapfeka mamask, togara takapfeka zvinodziya bose fanenge tichidziyirwa and kugara panze togona kudziya moto kana kupinda mahostels topiwa mablankets kana usugutsikana nemablankets aunenge unawo they are able to give you more blankets ekuti udzirwe. At least wasapindwa nechando ungopreventawo zvinhu zvacho zvekudzivirire ungogara mumba hapana zvatingazviite.
Saka iwe ungati uri panapa hauna fear yokuti ndogona kubata COVID panapa?
Aiwa, necare vari kutipa handina fear just because newe kama ndakatopiwa takatopiwa mamaski wotorwa temperature woonekwa kuti zvese zviri ball even BP because we paart. Paart kwangofanana mwana mucheche ndingada totarisa kuti hapana akosora chichazoitika because ukatokosora vanobva kuti mhanya unoti chikosoro chichikubva nekupi.
Well, that's Sharon. She is an admitted patient here at Mashambanzo. I would also want to find out from a visitor who's coming to visit a patient here, what are the precautions that are being put in place? Mama, tiri kuona imimi mauya pano pahealth center kuti muzoona munhu ari kurwara zveCOVID. Mama mbozvinzwa zviri kutaurwa nehurumende handiti? Ndoda kunzwa kuti imimi sekuuya pano pachipatara zvii zvavakuitai kuti munge muchizvidzivirira kubva kuCOVID?
Kuya kwataita pano tasvika pagedhi ndobva taona pane mupurisa aripo, ndobva tichimbomira ikoko, ndobva tamira, ndobva ti muri kudani, ndobva tamutsanangura kuti toda kuona muroora ari kurwara ane mwana uyu. Asi kuti tinyatsozotsanangura kuti akurumidze kutibatsira tazotaura system akuyani tine nyaya naye. Ndobva ndikandifoni, ndobva afona sister akati vapinzei. Tapinda atitora temperature nepamhanza, ndobva atipa izvozvo sanitizer. Ndobva tazoenda patanonyika makumbo, ndobva azotipindai, ndobva tauya. But tapinda pano, aiwa tapinda takasununguka kunyatsoona kuti tiri kupinda pachipatara. chakasununguka uzofila bit kuti pamwe ndingangosangana nezviri kutaurwa neCOVID nekuti yagara tudza kuti kana mapinda musabvise mask zvichikwadoti tangopinde usvikira tigare tione muroora nanhasi takangoisa mamask
aiwa muri kuzviona zvipatara zvedu muno muZimbabwe pano patiri pamashambanzou tiri kunzwa Minister of Health vari kutaura, President vari kutaura, vese veutano vari kutaura kuti let's make sure kuti we sanitize, we wash our hands, our temperatures are checked, especially when you are visiting my health centers. Muri kutonzwa namama zvipatara zvedu zviri kuteedzera. Saka isusu semhuri yeZimbabwe, let's always make sure that we take the necessary precautions so that we protect ourselves from COVID-19. After the break, we are going to continue looking at HIV treatment, care and support in this COVID era. What should be done? Getting the medical perspective. Join us after the break. Welcome back. We continue with our discussion where today we are looking at the issue of HIV care and treatment, and mainly focusing on this COVID era. We are at Mashambanzo, an institution that many of us know that it caters for people living with HIV as well as AIDS. Sister Cecilia Tom is now joining us. I know a lot of us are actually worried just to visit a medical institution, a medical center. We had in our first segment a patient who's here at Mashambanzo reassuring us that all the necessary precautions are being taken to ensure that they are safe from COVID. We also heard from a visitor telling us what she went through for her to be able to eventually see their relative who is admitted here. All those precautions being taken to ensure that people are prevented from getting COVID-19 infections. Sister Tom, welcome to the talk.
Thank you, Tari.
Yes. As a center, Mashambanzo, you deal with people who are not feeling well, maybe HIV infections and opportunistic infections. Some even maybe are moving on to the stage of AIDS.
Exactly.
And now we have COVID-19. And we hear people talking about when you've got pre-existing conditions, you're actually at risk. And already if I'm HIV positive, I'm here, I'm sick, it means I'm more prone to get COVID-19.
Exactly.
What are you doing as an institution to ensure that yourselves as frontline workers are protected from COVID-19 as well as your patients and the visitors?
Okay. Basically, what we have done as an institution, even before the lockdown was introduced, we had started scaling down on our activities. The outreach nurses, we had actually stopped the outreach visits and would only work with the caregivers in the community. They would see the patients in the community and refer them to us, not us going out to them, because we knew it was very risky for our staff to go there. So we also did a training on all members of staff, both medical staff and non-medical. We did a training on COVID prevention and management. So that's what we did. After that, we conducted health education to our patients who were admitted then. And it's an ongoing thing. As soon as we admit a patient, we give them health education, and on daily basis when we do our evening devotions, we also have a few minutes to talk on COVID. So all staff here have been trained on COVID prevention and management. The patients who are here as well, they have been sensitized. So after the trainings, we went on to have a tent by the gate that we have as a temporary shelter in case we have people who come in with the signs and symptoms of COVID. So what we do, previously, we would just have patient presenting by the gate we ask them to come straight to the ward. So when this COVID era started, we stopped people coming in directly to the wards. So when we have someone who presents by the gate, be it a patient or someone who has a problem that we need to address, the guard will alert the nurse in charge. So the nurse in charge at the moment, we have to don. By donning, I mean putting on the PPE. So you put on your PPE, you go to the gate and you screen your patients whilst they are still out of the gate. When they present with anything that would appear to be linked to COVID, then if they are like more to the positive COVID-19 symptoms, we put the people in the tent and immediately alert the response team. But we have been fortunate so far. We haven't had anyone presenting with those kinds of symptoms. So we have been able to admit all the patients, all our clients we have presented by the gate. Yes.
But looking at the patients that you have, it's not my first time coming here. I'm actually seeing that you've got a low admission rate. Are you also reducing the number of patients that you are taking, or?
We haven't reduced the number of patients that we are. If anything, we have actually created some other wards in anticipation of more people coming in. But I believe whenever you hear someone saying, I've been to the hospital, the first thing that comes into your mind these days is, I'm exposing myself to COVID.
Exactly.
So I guess we have these low numbers because the patients are also afraid of presenting to the hospital because they are afraid they would expose to themselves to COVID. But when they do present now, that is when we are having a challenge. Because when they come, they are in such a poor state. And you would wish that person had presented earlier. Because recovery is quicker and very much possible when one presents earlier.
Well, we'll continue with this discussion after the break. Welcome back. We continue with our discussion on the Talk with Tariro. Sister Tom, I want to find out, you know, for me as a patient, if I'm here and Sister Tom is coming to treat me, I'm also scared to say, but Kumba, am I safe when she's coming back? As well as there's an issue of somebody coming into the center and then being admitted. What if they are asymptomatic? And what if there's, you know, with HIV, we had that window period. With COVID, are we also looking at that?
Well, I'm happy to say that as staff, we have been screened for COVID. And each time you report for duty, those who go home, they are checked their temperature. If it's normal, then they are allowed to come in. If it's above normal, then the sister in charge is alerted, and it doesn't matter that he's a member of staff, he or she's a member of staff. The sister in charge will have to go and attend to that member of staff who is pyrexial. And also, I think it's also important to mention that as staff, we have been protected as well. Our families have been protected because, like the nurses who are working in the wards, we are having to stay in at the hospital. We don't like go home every end of shift.
Is that so?
Yes, we are actually having weekly shifts whereby one comes in on a Monday morning and you can only go home on Sunday evening after you've been finished your shift. So you have 1 week on and you also have 1 week out to breathe. That's also taking the preventive measures when you are also at home. So you are protected whilst you're at work, and that also protects even the patient because it doesn't mean when you're a medical practitioner you don't get COVID. You can actually be infected as well.
Exactly. We have had a lot of cries that are coming from medical personnel talking about the issue of PPE. Wow. How is the situation with you?
At the moment, I can safely say, as much as the PPE is concerned, we can say we are covered, because we actually have the PPE in as much as what we think is needed. Because with me here, I've got some of the equipment that we use for the PPE. Obviously, I have the face mask that I put on when I'm on duty. The moment I enter the gate, I change from the mask that I have, I put on something new, and each time I feel I have to change it. That's about in the space of 3 hours or so. I have to change this surgical mask and put on something new. And also when I'm in the wards, I don't put on bare shoes, just the shoes that I have from home. I have to cover my shoes as well when I am in the wards. And we have our headgear. It's the headgear. This is what I also put on when I'm just in the wards. Here we are talking of in the wards where we are saying
like this.
Yes, where we are saying our patients are COVID-free. We believe we have the gloves that we have. These are just the latex gloves that we use on day to day. And when a patient presents by the gate, then we have got these N95 masks that we use. Because there's a difference between this surgical mask and the N95.
So that you wear it when you are going to the gate when somebody presents?
Yes, because I'm not even sure of what I'm going to face out there. So I have to be fully protected. So I put on this N95. I also have my goggles that I use. Yes, and then of course the shields.
So the shield, you put it on whilst you are putting on the mask as well, or this can replace the other mask?
No, I put on my mask. I put on my mask, then the shield.
Then the shield.
Yes.
Okay.
It's the mask and the shield. Then we have these coveralls that I wear on top of this.
And now I'm acting like a health person now. Yes.
Yeah, so then I have to put on this coverall as well. This is more of an overall. That we have.
And is it one-time use, or you wash these ones?
You use, you discard.
Oh.
Yes.
So you get them every day?
Yes.
Okay.
You use, you discard. Because sometimes it's already contaminated. Yes. So you've got to discard it.
So I want to find out from you, as a medical personnel, as a frontline personnel, do you feel safe?
You cannot say I'm 100% safe, because obviously the overall protection comes from God. The overall protection comes from God.
Yes.
But as far as the human effort is concerned, we can comfortably say that we are protected as an organization.
Yes.
All the necessary measures have been put forward.
Yes. And what would be your message to people living with HIV? You deal with them on a day-to-day basis. And you know, there's always a challenge of that I'm witnessing. Last week we heard from one sister from your center talking about how almost like HIV is re-emerging compared to where we were, because there is the issue of non-adherence, getting tired, putting myself on a treatment holiday, and with COVID being around, and then us slackening like that. What would be your message?
My message to my clients, colleagues, or everyone living with HIV, even those not living with HIV, because it's either we are infected or we are affected. So we are in this thing together. It's adherence. Because already the immune system is compromised. So if the immune system is compromised, then you do not take your medication correctly, then the situation will just get worse. It will get worse. So please, 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 let's adhere to our medications religiously, especially in this COVID era, because already we are compromised. We are on the losing end. So just like the message that we put forward to the young ones and to the elderly. The people living with HIV are also in that same, not just HIV, all those, some existing conditions, the asthmas, the diabetes, the hypertensions, or everything. If one is on chronic medication, we just need to take our medications religiously.
Well, that's all we had for you when we're looking at the issue of HIV treatment, care, and support as well. We are in an era where we are talking about COVID-19, and most of the times we are skeptical to visit health centers. We heard from Sister Tom saying, when you present yourself when you're already sick, it becomes a challenge. Our health centers are taking all the necessary precautions. We are at Mashambanzo, and for us, even getting in wasn't as easy as it used to be pre-COVID era. We had to be screened. They had to take all the necessary precautions. And I'm sure all our health centers are doing exactly that. So it's important, if we are not well, if we have pre-existing conditions, let's seek our services. Until we meet again next week, it's goodbye.